Mercedes Mason, along with Dr. Elliot Berlin, are with us to talk about breech births, which is what it's called when a baby is born bottom first.
Or feet first.
Or feet first instead of head first.
Yeah. Okay, there's no longer a choice, basically. Choice has been taken away from women as to how that baby should be delivered. So here's some background from the documentary film Heads Up.
Up until the year 2000, a woman carrying a breech baby had two choices. She could have a vaginal breech delivery or a cesarean breech delivery. In 2001, one of those options disappeared almost entirely.
I would have liked the option to deliver a vaginal birth with my baby. It wasn't even a choice. It was, you have a breech baby, we're going to do a C-section.
All right, Dr. Berlin is with us. Mercedes is with us as well. 2001, there was a study called the TBT study that basically changed the thinking about breech births. Can you tell us about that?
Yeah, I think it was done in good faith. I mean, since cesarean section became safe, it used to not be safe, we try to see who would be a better candidate for vaginal birth and who would be a better candidate for cesarean birth. There are some types of births that are inherently dangerous vaginally, and by doing cesareans, we can give those mothers and babies a significantly better outcome. So the term breech trial tried to apply that to breech babies. There are certain complications that can occur with the delivery of breech baby vaginally that may not happen with cesarean. So the study had a small but statistically significant finding originally that women would be safer, babies would be safer born by cesarean if they were breeched than vaginally. However, a follow-up study and some analysis of that study showed that it's not necessarily true. So first we changed the policy to stop doing breech birth, and then we brought it back in 2006.
Well, here's why it's significant, because during that time period, doctors were no longer being trained to perform a breeched birth. Therefore, women didn't even know this was an option. So that wasn't even on the table for them.
Exactly. Midwives, first of all, never stop training on breech birth. Most midwives still do get training on it. Unfortunately, in California last year, they took away midwives' rights to deliver breech birth. Hopefully that'll come back soon. But just as you said, Roxy, doctors aren't trained on how to do it anymore. And so younger doctors don't give that option to their patients. They just let them know there's only one choice. However, there are older doctors who do have the skill and never stop practicing breech birth. It's the current guideline of the American College of Obstetricians and Gynecologists to offer that choice if you have a skilled provider.
So listen, there's some conflicting information out there. And if you're about to have a baby, it's very difficult to deal with that. Is there a 4% increase in mortality, for instance? Are there things that are dangerous if you deliver vaginally? How do you react to people reading that?
Well, you can't put anybody in a vacuum. Some women who have breech babies are definitely better candidates for vaginal birth, and some women who have breech babies are definite candidates for cesarean birth. Most women are somewhere in between, and for that reason, it's upon us, the providers, to sit down, tell them the pros and cons of both choices, and let them make an informed choice.
It's
and we have to
about
support
informing the patient, which is why Mercedes.
Yes, I want to make an observation here. You have never been this quiet in all the years I've known you.
She's listening intently. But that's what it's about, choices.
Look, exactly. At the end of the day, I don't have children yet. When I do, I want options to be available to me just like they should be to other women. It becomes an issue of women's rights. I don't want to be on an operating table if I don't have to be. It's a major surgery and it's scary. And you should be given other options, especially when there are trained professionals who are able to deliver breech babies. I've never seen anything else in healthcare where surgery is forced upon a patient.
Is this for you an issue of women's rights?
Absolutely, 100%, and patients' rights. It's a slippery slope. Once you start taking this right away, once certain hospitals can decide what's better for the hospital versus a patient, it's a slippery slope. Changes are going to start coming, and we need to put a stop to that now.
It's all about having the information. I recently had a baby, and I remember when I went in for that final ultrasound thinking, I hope the baby isn't breeched because I don't want to have a C-section, not knowing that perhaps that didn't even have to happen.
Right, and most women don't. The earlier you find out about a breech baby, the more you have to do about it. So normally we don't check until 36 or 37 weeks. But if you ask at 32 to 34, you can use chiropractic, acupuncture, massage, reflexology, hypnotherapy. lots of things to encourage that baby into a more ideal position and
But,
not have to deal
but
with
also
the breech
there's an
birth.
art to turning the baby.
Yes.
Exactly.
And if people don't know the art, you can't do it.
And
saw
I
a
just
video of
have to
that
say, Dr.
recently.
Berlin, amongst all my celebrity friends, if you will, is a celebrity in his own
Oh.
right. He is incredible. Every person I know, every female friend who I have who has given birth or is pregnant, just adores him because he's able to provide these different options. And once this goes away, these poor women in the future won't even have that.
All right, thank you both for being here. It's a topic that a lot of people are not even aware out there now. There will be a rally against a ban on vaginal breech birth tomorrow from 11 a.m. to 3 p.m. at the Glendale Adventist Medical Center. Get more info on informedpregnancy.com. You're holding a box, Doctor. What are you doing?
Yes, I have a present for Roxy.
Oh, thank you.
Baby. This is
What
my-
is it
Thank
called?
you so
It's
much.
called the Ollie Swaddle. It's my favorite one because even dads can do it.
Oh, really?
Yes.
Perfect.
Informedpregnancy.com.
Thank
you
you
both
so
for being
much.
with us.